Congratulations, you made it to menopause. So many women did not get the privilege or did not have the privilege of reaching this point in their lives. But here we are experiencing it. My name is IJ. This is Wellness with IJ, where we talk about everything health and wellness, men, women, and menopause. Today, we're going to talk about the topic of hormone replacement therapy, which is one of the ways of managing the symptoms women experience during menopause. If you're experiencing hot flashes, night sweats, then you're not alone. HRT or hormone replacement might be a solution to most of your problems. So let's dive in. HRT hormone replacement therapy is a process of replacing the hormones that we miss when we go through menopause, mostly estrogens and sometimes progesterone. They're available in different forms, so you can have tablets, you can have patches, creams, rings, and even vaginal creams and gels for local effect. So if someone is experiencing a lot of vaginal symptoms, then a vaginal cream might be more beneficial and less risky than using a full-blown hormonal replacement. Now, it's really important for you to know that every form is not appropriate for every patient. It's all going to depend on other factors. For instance, your medical history, your lifestyle, and all those factors will help determine which one your doctor will choose to put you on. So, hormone replacement therapy is best for those vasomotor symptoms, those symptoms that result due to the activities in the blood vessels. So whether the blood vessels are contracting or dilating, things like night sweats and hot flashes. It's also good for mood swings, anxiety, vaginal symptoms, and those kind of effects. One huge benefit of HRT is for osteoporosis. Remember, we've spoken about bone loss as a result of menopause. So it's really important to take care of that, especially for people who come from certain ethnic groups that are more susceptible to bone loss than others. The whole point of hormone replacement therapy in menopause is just to improve the quality of life. The symptoms of menopause can be quite distressing. It can change or alter your quality of life such that you can no longer function. So the whole point of hormone replacement therapy is to improve the symptoms so you can have a decent quality of life. I'm 55 years old and I'm currently going through menopause, and I can tell you that at some point during this process, it was impossible to sleep and I could not function during the day. So the purpose of hormone replacement therapy for those who can be on it is really to improve your quality of life, at least so that you can feel as close to normal as possible. So it's worth pointing out that just like most other things, hormone replacement therapy, they have their own side effects. There are some that are headaches and dizziness, up to the fact that there is a slight increase in risk of developing certain cancers like breast cancer. Also, if you have a history of blood clots in your family or stroke, then HRT can sometimes increase the risk of that happening. And that's the reason why hormone replacement therapy is not for everyone. Like I said earlier on, this is a decision that has to be made between you and your doctor. And your doctor will consider your history and your lifestyle. And you also have to take into consideration what your day-to-day activities or what your activities of daily living are. Because if you're not able to take tablets on a daily basis, you might want to use a patch or other forms. That's if your doctor feels that you might benefit from HRT. So that's the reason why this is a really important decision for your doctor to make, because there's so many factors that need to be considered before you're put on any form of hormone replacement therapy. HRT generally is considered safe for healthy women, and typically your doctor would consider HRT if you qualify to be on it if you're less than 60 years old and you went into menopause in the past 10 years. I remember that a lot of the consequences of menopause tend to happen soon after you reach menopause, which is 12 months after you had your last period. So, for instance, bone loss is highest within the first few years after you've hit menopause. So it's not a dangerous treatment, but like I said, it does have its own side effects and risks, which your doctor would consider. So it's only for women who suffer moderate to severe symptoms. So if you're just experiencing mild symptoms of menopause, your doctor may consider other forms of management that we will talk about later that are not HRT. If your doctor feels that you don't qualify for HRT, there are other options. So it's not the end of the world if you don't qualify for hormone replacement. So at the end of the day, menopause is a journey. It can stretch over several years for some people, and for other people, it could just be a couple of years. So there will be some ups and downs along the way. There will be some symptoms. It's just worth knowing that you're not alone, that there are ways to manage some of these symptoms, and some of them may involve hormone replacement, and others may just involve other measures that are not related to hormones. There are also medications, but not hormonal medications, as well as other natural ways and things you can do to help reduce the symptoms that you suffer. If you have learned anything from this video, please like the video, subscribe to the channel if you haven't. And if you have experienced menopause, or you're experiencing it, or you've been on HRT, please share with us in the comment section so that people can see that there is life after menopause. And until my next video, you have a great day. Goodbye.